Hello everyone, I'm Nikita Sharma, a student of NLM course. So today I'm here to present the presentation on the topic Community Assessment on Aged Populations. So first of all, let me introduce my group members. Firstly, it's me, then my friend Simranjeet Kaur and my friend Virender. So here I begin. So let me first give you the overview about what this presentation includes. So first of all, we'll be discussing the aged community and the problems related to healthcare issues in India, purpose of the community project, applications of approaches to future development of the aged community, and lastly, we will be evaluating the community strengths and limitations. Moving further, discussion on the community and its problem. The community selected here is aging community of Canada. So, the major concerns or the major challenges in the healthcare facility, they are faced by the elderly or the old age people in Canada. This is usually because of lack of socio-economic and environmental resources. Now, let's discuss the reason behind choosing the community. Selection of aged community is having the reason on understanding the cause behind the poverty and unemployment that is having the dimensions of deprivation along with high level marginalization. So it clearly states that the main reason behind which we are studying this community is that we shall understand the poverty and the stages of unemployment that the people are facing. Second is lack of healthcare resources and social exclusion is another reason to choose this community. So, the hospitals and this community lacks healthcare resources due to which they are not provided with the proper healthcare treatment and facilities. Although the elderly population is at higher risk of chronic disease, they do not get quality health services due to low income. So, the chances are more, the risk factors are more in the elderly, but the chances of getting them treated or early rehabilitation of these criteria is very low due to their low income. So usually people get retired and they do not have enough savings so that they can get done their treatment. Last is the selected community is one of the primary communities that is highly vulnerable in Canada. What will I do to meet the needs of community development? So it's been divided into primary and secondary level. First is the primary level, interviewing organizations working with aging community. Secondary level, it includes the journals and articles, collaborate with the health promotion programs, foster the old care workforce. Next is, why would I choose this type of assessment to meet the needs of community development? This is in-depth assessment such as interview would provide such a structured framework of navigating health issues. So both primary and secondary methods of research, they provide in-depth knowledge and realistic situation of what is really happening in Canada. Next is the community's limitations or challenges. So as you can see, increased Medicare, poverty, unemployment, low income, depression, people are so stressed out in the old age and they have many physical health declinations, and even their cognitive ability to think is also declined. So these are some of the reasons. Now, next part, from this part, my friend Simran will be discussing. Thank you.
Good morning. My name is Simranjeet Kaur. Now I'll further continue with the presentation. First of all, thank you, Nikita, for explaining the limitations. And now I'll continue with the organization which are involved in this community, which will help the community. The first one is Health Risk Assessment Community, in which they'll try to assess the health of the people, the old age people, so, and by comparing the chronological age with other people, so that they'll know that what is the health status of that person. Next one is routine health screening. In this, they do the routine health screening, as we all know, so that we can diagnose early if they'll having any diseases so that we can treat it effectively, like cancer, hypertension, and any others. The next one is fitness activities. As we know that old people, they don't do that much activity, which made them immobile, and they just try to sit for a long time. So to promote that, we'll try to give them fitness exercises so that they'll move their body and they don't get immobile and they'll remain fit for a long time. The next one is adult daycare. In this program, we'll give care to the patient in the daycare in their home only, when we'll go to their home and we'll provide them care. The next one is health promotion program. These are the promotion programs in which we try to promote the health. As we all know, old people have a chances to get the osteoporosis, so we'll try to promote their health so that we'll try to prevent them from the osteoporosis as long as we can. So next one is medication management. If any people, any old age people will get diagnosed with any disease, in this program we'll give them medication management that can be given by RN and a physician. The next one is senior centers. Every country has a senior centers in which the seniors can interact socially with each others, and also they get sponsored for the outing so that they'll try to make them happy and try to reduce their stress. The next is gatekeepers and stakeholders. As we all know, in this program, there are the physicians and doctors which provide care to the old age people, and the pediatricians and family practitioners, they all are called as gatekeepers. They are giving directly or indirectly care to the patient. On the other hand, the stakeholders are the companies and the government. The program made by the government, they all are called comes under stakeholders, because they are also try to give care to the people. The next is how we would communicate with the aging population, because we know communication is a main focus when we are treating with the old people. So then only they can vent their feeling to us. So how we can communicate with them? We can communicate with these people through social medias. We know everyone can afford social media. It is very easily accessible for anyone, and we can communicate with the help of social media to the long spaces also. So next one is we can share the sufferings of old people and health issues they are facing through articles. If today I know there is a old people who is suffering and they are having health issues, so if we'll place that issues in the article and the videos by taking their consent, then obviously the other old people, they'll come up and they'll try to tell their feelings. The next is people can hear our voices through interviews and campaigns. We can arrange different campaigns and interviews so that we can raise our voice and will make aware old people so that they can get better health. The next is whose voices may not be perceived regarding this problem. Sometimes there are some people who they try to talk, but they are not able to raise their voice. How it's possible? As we know, the old people, they don't have that much energy. They are not that much aware. They are weak. So sometimes they tell their feelings and they tell their ideas, but no one hears them. So on the other hand, will make aware to the young people also so that they can raise their voices for old people, so to the betterment for their health. The next one is how might you involve them in this community access? We can include the old age people in the community assignment process through their interviews. We can call them, we can interview them, we can know about their feelings, the problem they are facing, then we can plan intervention according to them. Second, we can create awareness program involving old people to inform them that what are the issues in their health, what are the solutions, what are the opportunities they have, what is their right that they can get from the government. The next part is the strength and limitation of approaches you selected in the community assessment. This part will be further continued by the Varinder. Thank you so much.
Through it, we can find the problems in community area. If I talk about the community assessment strengths and limitation, the strengths of community assessment is we can find the weakness of the community, such as lack of unity. We can take example, lack of unity through if the lack of unity in community area, people can't raise their voice for their rights, and we can also find the risk and threats in the community, such vulnerable disease, because there are a lot of vulnerable disease in different area or regions, such as diabetes and food poison and so many more. And in addition, we can through the community assessment, we can make better life for the old age people, tell them about their rights and assess their problems, and we can tell them a lot of things about their life, and in addition we can told them about the map and guidance of their life. We can tell them the guidance and roadmap for their life and upcoming generation. Through this assessment we can for the betterment of the life, we can tell them like safe drinking water, proper hygiene and sanitation, so they can use it and make their future better. If I talk about the strategies to improve the betterment of old age people, we can provide them the funds, such as some government organization, non-government organization provide a set fund monthly, so they can use it for their daily expenses. And connecting to the family, we can encourage their families and friends, so they can connect with the old age people, so they can talk them and and spend some time with them. And signs of depression, we can also find signs of depression in the old age people, because they are vulnerable to this kind of disease. In old age, sometimes they feel loneliness, and towards better medical care, we can provide them better medical care and regular treatment, so we can find any kind of disease in the older people in their life. And if I talk about the new technology, we can tell them about the new technology. They can use social media like Instagram, Facebook, so they can update themselves through these kind of things, and they can spend their quality of time for these kind of websites. And I want to include them, then give some household work like gardening, like easy tasks such as gardening and some like cooking skills and so many things, so they can spend their time and they can busy themselves in their life, so they can't feel loneliness in this world. And also they can spend their time in same age group, so they can feel better if they share their thoughts and ideas with their same age group, so it could be better for the old age peoples. If I talk about the advocacy of community assessment, some volunteer groups can aware the old age people and also the community people about their rights, and also tell them the strategies of the government, so they can take benefits from it. And in last week, I can explain the ethical considerations of the community assessment. In ethical consideration, we can take consent from the people, so in which we can take consent of the people and tell them about our group, which group we are belong, which volunteer group are we belong, and who funded us, and in which we can't harm anyone like physically or mentally. We should take care of it. And in addition, we can add like we can like confidentiality. We can add some. We should keep the data and other things confidential, because we don't have any right to share their data and their problems to anyone, to anywhere. Thank you. My student ID is 152272116. So today I am here to continue the group topics of my classmates. Community assessment of old age people. Community assessment is a very good strategy. Through it we can find the problems in community area. If I talk about the community assessment strengths and limitations, the strengths of community assessment is we can find the weakness of the community, such as lack of unity